My name's Alana. I am a practice nurse. So I work with general practitioners. I work with other allied health and community, along with family members and kids of all ages.
What is a practice nurse?
A practice nurse works with you and the whole healthcare team to really understand what is most important to you and your family. We work sometimes in the treatment room, so doing vaccinations or immunisations. We might be doing a height, weight, general wellness check. We might just have a general chat with you and work with your GP and other healthcare professionals to help support you. You will find a lot of practice nurses in scrubs, or might be a different uniform depending on the practice that they work at. You could always ask the receptionist to point out the practice nurses or the GP to let you know who the nurses are at the practice that you go to.
What can I expect if I see a practice nurse?
What you might expect when you see a practice nurse is that we will ask questions to get to know you, get to understand what your day-to-days look like, what health and wellness might mean to you, who is around you, your family, your friends, your sort of social network or support people that you might already have. Practice nurses can have a variety of backgrounds, so they might not have always just worked in general practice. They might come from mental health backgrounds, they may come from child and family health backgrounds. So if you have a question during your child's appointment, something that you think is of importance, you can raise it at any time, and the practice nurse can really sort of come up with the best approach, whether it's something they can do in that appointment or whether it's something that maybe needs a longer time and a longer appointment to be followed up and arranged for you during that conversation. And if they don't know how to help, they generally know who is the best to be able to continue to help support you. And a practice nurse can also help to maybe encourage you to have the conversation with GP or other allied health providers as well if they think that it's something that will benefit you.
How can I access a practice nurse?
There's a variety of ways that you can access a practice nurse. Some practices are set up to actually be able to book directly with a practice nurse through their online booking system. You might be asked to see the practice nurse following a conversation with your GP because the practice nurse might be able to offer a bit more time than sometimes the GPs can be able to offer. You might see a practice nurse prior to your appointment with the GP. The fortunate thing with practice nurses is they work really closely with GP and other allied health professionals and sometimes have that extra time that they can give to you if there's a pressing sort of question. If it's something that they realise that their time is also limited, they can coordinate additional follow-up for you and they can direct you to the people that can give you the best support to give you the best outcomes.
Are there common misconceptions about practice nurses?
I think there can be misconceptions where people might think that practice nurses are limited to only doing immunisations or only doing wound care, but more often than not, practice nurses come from a diverse background and actually have a lot of additional skills and knowledge that they can maybe apply and provide value to you. Ask the question, and most practice nurses, if they don't know, they generally know somebody who does, or they are more than willing to find out.
How can I get the most out of my visit to a practice nurse?
Think about what's most important to you and if you have any particular goals in mind that you want to achieve. If you think that there's any relevant items or something that might help a practice nurse build a rapport with your children, feel free to bring that along and let the practice nurse know those little things that are important or valuable to really make the most of those appointments. Think about questions that you have and don't ever hesitate to ask those questions of your practice nurse, because if they don't know, they can at least give you that support and direct you to who would be the most appropriate person to ask those questions to.
A final word.
Practice nurses can be your biggest advocate outside of the family network, and engaging with your practice nurse is a really important dynamic to creating a supportive network around you so that in times of challenge you can really get the most value from your whole healthcare team. A practice nurse can be that bridge sometimes between the connections that are there.